Now we'll continue our evaluation of the wrist looking at the volar aspect of the wrist. Our bone landmarks, once again, are going to be on the radial side will be the scaphoid, and the ulnar side will feel the piezoform. In between those two bones is going to be the proximal carpal tunnel. Starting on the volar part of the wrist, we're going to be looking at the carpal tunnel. It's always best to start on a bone landmark. I move the transducer in a short axis on top of the scaphoid on the radial side. And superficial to the scaphoid, you'll see an ovoid-shaped structure, which is going to be the flexi carpi radialis tendon. Sliding the transducer ulnar, we'll get into the carpal tunnel, and we'll see the area of the flexor tendons and median nerve. Now, to ask the patient to wiggle their fingers will help us identify the area of the flexor tendons. Now, sitting just superficial to the flexor tendon bundle is a thin fibrillar pattern of the flexor retinaculum that sits just superficial to the bundle of the flexor tendons. We can also ascertain or evaluate each individual flexor tendon group by isolating the tendon itself. Moving slightly to the radial side now, I can flex and extend the thumb, and we can see the flexor pollicis longus tendon in short axis. Moving the transducer slightly towards the ulnar side, we move the individual index finger, middle finger, ring finger, and the little finger. So we've identified each and every one of the flexor tendon groups. We'll slide the transducer slightly to the ulnar side now, over to the area of the piezoform. And the arrow is now pointed to the piezoform, and sitting just superficial to the piezoform is the flexor carpi ulnaris. Now let's identify the median nerve in the flexor bundle. As I rock my transducer back and forth, you'll see the tendon structure get black and bright, but superficial to the tendons, an ovoid-shaped structure with black holes or fascicles in it is the area of the median nerve. One way to identify the median nerve by looking at the tendons, once again, is to identify the area or the tendon of the flexor pollicis longus. By flexing the finger, the thumb, back and forth, once again we can see the flexor pollicis longus moving. The median nerve in short axis sits approximately at the 1 o'clock position and superficial to the FPL. Sliding the transducer to the midline, we are able to see superficial to the flexor retinaculum is a short axis of the palmaris longus. It's outside the carpal tunnel, and you can see the short axis of the tendon itself. Sliding the transducer more to the piezoform side, now we'll evaluate Guillen's canal. So we're going to identify the pulsing ulnar artery, the piezoform bone, and situated between the ulnar artery and the piezoform is the short axis of the ulnar nerve with a small fascicle sitting next to it, or within it. Going into a long axis on top of the piezoform, we're going to see the flexi carpi ulnaris superficial to that and attaching. Moving the transducer slightly radial from there, the piezoform will move out of the field of view, and we'll see the ulnar nerve in its long axis. Moving the transducer in its long axis even more radial to the center, we will see the bone structure at the bottom, which is going to be the radius. We'll see the flexor tendons as I move the fingers. Sitting superficial to the flexor tendons, we'll see the palmaris longus, and between the palmaris longus and the flexor tendons is the hypoechoic structure of the median nerve. Going back to the short axis, we'll take a look at the median nerve in the carpal tunnel. And now I'm going to slide the transducer towards the elbow. The median nerve is going to slide between the profunda and the superficialis tendons. And approximately this level, if you look towards the bottom of the screen, you'll see a muscle that's going in its long axis from the radius through towards the ulna. That muscle is the pronator quadratus. To isolate the tendon muscle structure, if we extend the fingers out and just move the fingertip, you will see the profundus muscle moving in the deep portion, just on top of the pronator quadratus. If I move the whole finger, the profunda and superficialis, which is superficial to the median nerve, all will move at the same time. So by isolating the fingertip, you can actually separate the profunda from the superficialis.